Thank you very much for giving me the possibility to present our project concerning medical pedagogy and social robotics. The title of this presentation is Virtual Patient Simulations through Artificial Intelligence Embedded in Social Robotics. My name is Alexander Borg, and I'm a medical doctor at the Karolinska University Hospital in Solna, and also a PhD student within medical pedagogy at the Department of Medicine, Solna, Karolinska Institutet. So in healthcare today, most health providing services are given at outpatient clinics and daycare units. This is not the same for undergraduate students within health professions education, since most of their clinical rotations are at inpatient units at hospitals. And representative patients might not always be present in wards. And when they are not seldom in a severe health state, making additional physical examinations not always fitting. This was especially highlighted during the COVID-19 pandemic, when clinical rotations were highly limited in Stockholm. There has been a consensus that alternatives are needed to train theoretical as well as practical skills to ensure that students meet the requirements of their learning outcomes. So what are virtual patients? They have been defined as interactive computer simulations of real clinical scenarios in educational or learning purposes. And they let a user interact with them in various ways to explore the virtual environment, such as asking for information regarding a patient's medical history, performing specific tests and further evaluations, such as auscultation of the heart, the lungs, performing blood tests, and also they often include diagnostics and the decision of a management plan for a patient. They can give a broad exposure of patient cases and also ensure that students meet representative type cases. They give disease presentations that serve the learning outcomes and are very accessible and also a safe learning environment for students. They can explore this environment without the fear of performing medical errors. In undergraduate health professions education, virtual patients have been used by medical and nursing students during the last years. Listed here are some of the ones that we have been using at the Karolinska University Hospital, RumaCase and VIC. They are both examples of semi-linear conventional VP platforms, and this means that they always start and end at with the same in the same way, while exploration of the environment can go in multiple directions. The user gathers information in the order that they want to, pretty much. Students believe that these platforms encourages clinical reasoning and is a good way to practice clinical scenarios, but that they miss the authenticity of real patient encounters. We now have access to new, more modern methods of virtual patient simulations, where large language models combined with social robotics constitute one of them. In this picture here, you see a familiar face to your left and some unfamiliar ones in the top right and in the bottom right. These are the VP platforms that have been used for VP simulations within the medical course of internal medicine at the Karolinska University Hospital in Solna. In the top right, you have RumaCase, where 4 patients are presented in a primary care unit, and in the bottom right is VIC, where users can explore the environment by clicking different tabs and the questions that are pre-written here in the left. You then see we're given an answer in the text box here to your right. I will now give a demonstration of a virtual patient simulation using the social robotic platform Furhat. By using a large language model, we imputed a patient description as seen to the left here, and also used the large language model for the facial expressions and emotions expressed by the patient. Let's watch.
Good day, doctor. My name is Michael and I have this ache in my body that just keeps bothering me. Can you help me?
Good day, Michael. My name is Alexander and I'm your physician today. I will try to help you the best I can.
Thank you, Alexander. I really appreciate your help.
So can you tell me when your symptoms first started?
It all started out feeling like the normal flu, but then I started experiencing muscle pain and feeling really sick. After a few days of symptoms, I went to the emergency room.
That sounds rough. Have you been experiencing any other symptoms?
Yes, I've been feeling unusually tired and fatigued, lost my appetite, and have been experiencing a headache that doesn't seem to go away.
Okay, do you have any idea yourself as to why you're feeling this way?
No, I don't have any idea. It's just been getting worse and worse.
Are you afraid of anything specific?
I'm afraid it might be something serious. I've never felt this kind of pain before, and it's really affecting my daily life.
Okay, I see. Do you have any specific wishes for today's meeting?
Well, I'm hoping you can help me figure out what's causing my pain and these other symptoms.
I will do my best to help you the best I can, Michael, and try to get to the bottom of this.
Thank you, Doctor. I really appreciate it. It's been a tough couple of weeks and I'm just looking for some answers. Good day.
Okay, so when the patient case is completed, we also have explored the possibility of evaluating the dialogue by asking the large language model used if some questions have been asked. You see in the picture to your left that green text highlights if specific questions have been asked, and they are highlighted in red if they were never addressed. The picture here illustrates an evaluation of the dialogue that you just heard through the video demonstration. So we conducted a pilot study where we wanted to explore if undergraduate medical students' training in clinical reasoning was enhanced by virtual patient presentation through a social robotic platform as compared with a conventional semi-linear VP platform. 11 students were recruited from a student elective course within rheumatology at the Karolinska University Hospital in Solna. Within the course, they already had to perform 5 virtual patient cases in the semi-linear virtual patient platform, VIC. One of the VP cases in VIC had also been translated to the social robotic platform, Furhat, which you just saw, using a large language model. Students were instructed on how to use the platform and were given as much time as they needed to complete it. And the case was that of a 67-year-old man, Michael, who had booked an appointment at a primary care unit because of ache in his body. We used a large language model to generate responses and facial expressions, and as previously mentioned, the patient description was used in the prompt. The students were asked to gather necessary information and reason with the virtual patient in order to proceed. And they could explore only medical history, but not perform any additional examinations of the patient as compared with VIC. The dialogue was audio recorded and transcribed verbatim using speech recognition software. In the picture at your top right here is the patient description as shown before to the left in the video demonstration. To evaluate the accrual of clinical reasoning skills, we used a validated questionnaire of self-perceived clinical reasoning accrual, specifically designed to evaluate virtual patient simulations. It consists of 11 items that are graded from 1 through 5, with the possibility to leave a motivation. The 11 items were spread across these 5 different categories. And we also explored a large language model-based evaluation of the dialogue that we are planning to use in coming projects. And it's important to underline here that we used the physical robot with the students and not this video demonstration as shown previously in this presentation. In the picture to the right in the screen, you can see the large language model-based evaluation as shown before, with the green text indicating that a specific question had been asked and red if it hadn't. So what do we find out? And I want to underline here that these are very preliminary results, as our study group is small. 11 students agreed to try out the social robotic platform. We used a physical robot, as mentioned, and while every one of them had performed the same case in VIC, only 7 of them had done the clinical reasoning evaluation for both platforms. It could therefore be included in this final analysis. 6 students were male and 1 was a female student. The mean age was 27. And as you can see to your right here, students were from different semesters in the latter half of the medical program. We had international students who took part in the course who were from higher semesters, while the Swedish students were from the 6th. And also a majority of the students did not have any previous experience with virtual patient cases. For authenticity of the case, and when asked if students felt like they had to perform the decisions a doctor would make in real life, we can see that there was an advantage of Furhat compared with VIC. We saw this also when students were asked if they had been feeling like the doctor caring for this patient. For professional approach in the consultation, students were asked if they felt actively engaged in gathering the information needed to characterize the patient's problems. Also here, we see an advantage of Furhat as compared with VIC. When asked if students were engaged in creating summaries, this also remained the case for Furhat. This could be explained by the fact that VIC included pre-written questions that could be asked multiple times, while Furhat was explored using the voice and dialogue. There were similar results between the platforms when students were asked if they believed that the case had helped them in enhancing their diagnostic reasoning, however, with a slight advantage of Furhat. The same was seen when asked if students felt better prepared to care for a real patient with this complaint. Very similar results. The last question addressed was if students believed that the case was a worthwhile learning experience and the overall judgment of the case. And here we see a clear advantage of Furhat as compared with VIC, which we believe is very interesting. Students were also asked about special strengths of the social robotic platform and left some comments here. They believed that the social robotic platform enabled a better way to ask questions. They found the interaction to be real, that the conversation felt realistic, and that they enjoyed the flow of the conversation. They also left some comments regarding the weaknesses of the platform, and they addressed that they could only explore the medical history and not perform any additional examinations, and also that the dialogue at some points felt a bit mechanical. Some additional comments were given, and the students stated that in general, they believe that this is an interesting learning experience, that they want to see this implemented more widely, and that it definitely has a place within educational programs of health professions. So, some concluding thoughts. As mentioned previously, virtual patients already have a place in medical education today, and they are an accessible way to simulate a broad variety of patient cases that students can explore in a safe environment. But are they fully optimized to reach their true potential? Well, despite having a very small study group, we observed a trend in our results showing that the social robotic platform was a strong platform in comparison to the already used platform VIC for VP simulation and the accrual of clinical reasoning skills. I've not included all of the items in the previous slides, but these trends stayed true even for the other ones. However, further studies are of course needed in order to be sure. Some limitations were that the study group was small, giving us less statistical power in our analysis. Also, the gender distribution in our population does not really correspond to the gender representation at the medical programs in general. And also the language used in the cases was English, which was not the first language of neither the Swedish nor the international students. However, some strengths are that all of the participants had performed both cases for direct comparisons. Some of the comments that were written remain for further improvement of the social robotic platform and for our coming projects, and also the novelty, because to our knowledge, virtual patients have never been simulated in this way before. And also, we believe that this is a better way of virtual patient simulation as compared with the semi-linear conventional platforms that we are currently using. We plan to create reusable cases and frameworks to inspire and apply within different medical fields. And since virtual patients are independent of a present teacher or patient with a rare or specific condition, we can continue to ensure that students meet representative patients within their study curriculums, which is important. We will continue to collect data for the previous research question addressed to get higher power. We also plan to include aspects of interprofessional collaboration to explore if early implementation of such aspects can be included in our simulations. We will also continue to explore this large language model-based evaluation of dialogue in order to compare that to a human teacher for objective assessment of clinical dialogue. And finally, we want to explore if communication skills can be improved through virtual patient practice using the social robot when using the same case, however, through different personalities. I would like to thank my supervisors, the fantastic research group that I'm a part of, my project co-workers, and also my mentor. And these are some of my references. And thank you very much for letting me present today at this Furhat conference. Very exciting. And now I think it's time for questions. Thank you.